the diseases of the respiratory system. The breathing system in humans, in some cases, is affected by diseases. And the most common of these diseases include, number one, asthma. Asthma is a common respiratory disease, and it has different causes. The first cause of asthma is an allergen. An allergen, we can say it is a foreign matter or a foreign material that if it enters into the body, it will be seen as an antigen and the body will produce antibodies against it. An example of an allergen is pollen grains. We have smoke, we have dust. We also have animal fur, especially some people are allergic to cats, others are allergic to dogs. Then we can also have scent from certain drugs. We also have some foods, like I know some people are allergic either to milk or to eggs. And we also have flowers. The second cause of asthma, we can have some lung or bronchial infections. Some infections of the lung or the bronchus, as I mentioned earlier on, may cause blocking of these tubes, like the bronchioles or the bronchus, with mucus, which makes it very difficult for oxygen to get in. So these infections are caused by either bacteria or viruses. The attack by asthma is more severe during cloudy or during cold conditions, because sometimes when a person is exposed to the causative agent, this person may develop some breathing difficulties that is caused by muscular contractions of the air channels. And here, the patient may produce a characteristic wheezing sound. So it means that the breathing is now becoming very difficult because the air or the oxygen cannot be passed in. So this individual produces a wheezing sound, and this is accompanied by difficulties in breathing. You can see them struggling to breathe in or struggling to push air in through the tubes. So then, how do we treat asthma? Treatment and control. So the first one that is very common is, I'm sure we have seen people having inhalers. So we talk about spraying a muscle relaxant. You just spray on the mouth directly on the bronchial tubes. So when you do that, it goes to the bronchial tubes and then it relaxes the muscles, which allows air to flow in. Two, we can have injection of drugs, or we talk about oral administration of these drugs, and these ones must be prescribed by a doctor. Three, the individual can also avoid causative agents. So if we have allergens like milk or eggs or even animal fat, an individual can avoid that. The second disease is bronchitis, and this is technically referred to as the inflammation of the bronchial tubes. Remember, the bronchial tubes include the bronchus and the smaller tubes that are called the bronchioles. So we have two types of bronchitis. We have the first one is acute